The desire of every mother is to give birth to a healthy baby, but it is not always that mothers get their desires fulfilled. Some babies are born with conditions that can be life-threatening. Whereas these conditions can be detected at birth, some occur at later stages of childhood. Most of them are correctable with early detection. "60 kilometers away from Nairobi is Bethany Kids, which is situated within the compound of AIC Kijabe Hospital. Here, Capital FM News meets 6-year-old Suaya from Burundi. At the age of 3, her mother, Maisara, started taking Suaya to hospitals in Burundi, thinking she had an eye problem. The doctor in fact diagnosed her and even gave her glasses to take care of the eye problem.
Nilianza kuona tofauti kwa macho yake wakati alikuwa na miaka 5.5. Ndio nikampeleka hospitali. Kufika hospitali wakampima, lakini nimbeba kwa daktari wa macho. Alipompima hakunambia tatizo. Akamwandikia miwani eti nimvishe baada ya miezi 2. Nikafanya vile, lakini hakubadilika. Hiyo wakati alikuwa vizuri tu, alikuwa anaenda shule, lakini mara kwa mara kinambia kichwa kinamuuma. Side ya right ina affectiwa, anakuwa hawezi kutembea, akawa sasa vile iko paralyzed kidogo. Alikuwa anakokota mguu na mkono, alafu na mdomo pia ukawa umechangia kwenda.
For 3 years, Suaya and her mother wandered from hospital to hospital, trying to establish what she was suffering from. It was until Suaya was 5 years old when a doctor in Burundi diagnosed her correctly. She was referred to Bethany Kids in Kijabe.
Nafasi nyingine ya 3 ambapo mimi najua, ndo daktari ananieleza, ambapo wanafanya upasuaji vizuri na mtoto anafaulu na anapona, in Nairobi, hususan Kijabe Hospital.
For 3 years, she was struggling with a medical condition called Hydrocephalus. This is a medical condition characterized by excessive accumulation of fluid in the brain, thereby increasing the size of the head. Bethany Kids is dedicated to surgical rehabilitation of children with hydrocephalus and spina bifida.
Now, hydrocephalus in simple terms is water in the brain. So we have those conditions, and we have had many children coming to us with that condition. We have a second one called spina bifida, and spina bifida in layman's language is just a split spine. It means that in the first 28 days of life, then the spinal cord should have formed normally and aligned itself to be a normal spinal cord like you and me. But in children with spina bifida, the spine didn't fuse as it should. And so there is a protrusion of part of the spinal cord along the back or the vertebral column.
Suaya and her mother are a happy lot after successful surgery in Kenya. According to Anne, the number of children with such conditions has been growing. Most of them make it after correctional surgeries, but unfortunately, some do not. Anne attributes some of these cases to poor parental services, especially where pregnant women fail to take folic acid. Others present their cases at late stages.
We need to encourage every mother that is planning to be pregnant to do a very simple thing. 3 things that they can do. Eat right, by eating foods that are nutritious and rich with iron and folic acid. Number 2, when they go to the supermarkets and they are getting foods from the shelves, to get fortified foods. And number 3, every mother plan to start taking folic acid? Because research has shown that it has a way of contributing to the formation of the spinal cord, so that now we don't have many of these cases of spina bifida.
Just like in Kenya, Sumaya's mother recalls her tribulations back in Burundi when her daughter's head started getting big. curses and witchcraft were terms used by her friends and neighbors to explain her daughter's problem.
Kila mmoja anaweza kuja anakuambia point yake. Labda huyu mtoto, labda unajua pepo mbaya zilimkumba, haukujua. Unaona? Nikasema huyu mtoto Mungu ndio alinipa naye, na sijatoa labda sijampea Mungu zawadi eti anipe mtoto. Na hii maradhi ya huyu mtoto Mungu ndo anajua sababu gani, na Mungu ndo atamponya.
Bethany Kids, which has a bed capacity of 67, takes care of children from Kenya, Ethiopia, Rwanda, Burundi, Tanzania, Uganda, Liberia, Morocco and Ghana.
We make deliberate efforts to identify those we can support. That is the word I would use. Those that we will support. We will encourage them and say, whatever you find, if you get 10,000, please come. Because then the surgery is not 10,000. But they should not stay at home with 10,000 trying to look for 30,000 more.
Even as we bid Bethany Kids goodbye, the wish of Iron Hunter colleagues is that every mother gives birth to a normal child. They are pleased also that mothers seek medical attention immediately they realize their children have hydrocephalus or spina bifida conditions. For Capital TV, I am Judy Kaberia.